Over to you. Excellent. So good morning. Today, you will be joined by Stacy Stotler, our new Senior Director for Healthcare Programs, who will be managing the PATH grant. And she will be walking through just information about the PATH program that you guys are implementing, as well as some notable practices that are happening across the colleges. As well as we'll dive into reporting and then also have time for discussion between pair and share, and just kind of give an opportunity for each of you to ask questions to one another, since this is a new project and for Illinois. And then we will dive into reporting and also identify some upcoming professional development. So with that being said, I'm going to turn it over to Stacy to introduce herself and to kick us off.
All right, thank you, Whitney. So like Whitney said, I'm Stacy Stotler, and I am the Senior Director of Healthcare Programs here at ICCB. Basically, I am overseeing the PATH grant. So as many of you know, I'm in my first month. So we are all kind of learning this new grant together, which is extremely exciting. We only have an hour today, so I'm going to go ahead and just dive right into the information. A lot of this may be a bit of a review for some of you. I do know we have some newer folks on the meeting today, so just bear with us as we go through some stuff that might be review. Definitely will be some new information as well. All right, so our overview of PATH, as we know, it is a $25 million grant, and the purpose of PATH, or the pipeline for the advancement of the healthcare workforce, is that for students to be able to get those certificates or degrees in some of those high demand healthcare fields in the least amount of time possible. So we want to get them trained, get their credentials, and get them into the workforce. You know that you are going to have students benefiting from wraparound services, and we have some really interesting ones that we're going to discuss on one of the next slides, or one of the later slides. So we know that there are shortages of workers in the healthcare industry, and COVID-19 really just made that a lot more obvious, or a lot more prevalent. So that's what the purpose of this program is to get that healthcare workforce built back up from the limitations that COVID-19 has placed on us. Also, this program is modeled after the Workforce Equity Initiative, and we will go into some of that training, or talk about some of that training later. So the purpose of PATH, we want to create, support, and expand the opportunities of individuals in nursing and other healthcare pathways. We want them to advance into the healthcare workforce. Again, I mentioned the shortages of workers, and you all know, I think should know, as we went through your implementation plans, the options that you can provide to your students can be both credit and non-credit in nature. All 39 of our community college districts are receiving funding under the PATH grant. We know that there was a base allocation of $100,000, and then we had 4 occupations that were weighted. So EMT, registered nurse, LPN, and CNA, those were weighted. There were 7 different SIPs that we could put, that were going to be weighted for the funding. There are a few exceptions for SIPs that are not going to be funded. So for example, dental, I believe optometry was one of them that was not funded under the PATH grant. And our focus with this funding is completion. So we're looking at how many students are actually going through the entire program and would be considered completers when the program is finished, or when they are finished with their program. We each had, or every community college district had, a completion target, and that was based upon data that we got from academic year 20, based on the student level information that was submitted by each community college. That completion target is reflective of only credit-bearing programs. Those targets may be met, though, with non-credit completions in those eligible programs. if the credential that they get at the end is industry recognized. So a student, like I mentioned earlier, we're looking at completions. So a student is considered a completer if they finish their eligible program in the academic year for which path is active. So this academic year, did they finish their program? Then they are considered a completer. Also, they can be duplicated. So perhaps first semester they complete their CNA, second semester they go on to one of the other programs, then they are going to be considered two times. They're going to be counted twice as a completer. Also, it may include students who began their program last academic year or in a prior academic year for which this was being implemented. So we're just looking at students that finish during the academic year for which the grant is active. So we're targeting those incumbent workers. So we want to see if, can we reach out to those students who are currently CNAs and upskill them to be, into the LPN program or whatever that may look like. So one of our target populations is going to be incumbent workers, and you're going to be counting those on the quarterly reports that we'll show you before we get to the end of our webinar today. So besides the incumbent workers, we're also looking at new or entering students on that nursing or healthcare pathway. These are going to be students who we have or you have identified as having a need for support, and they intend to continue their employment here in Illinois. So need for support, these are going to be low income, first generation minority students. That's going to be a subset of both incumbent and new and entering students. Okay. And when I was looking at the implementation plans, I'm assuming there are not a lot of questions thus far because those plans really did a nice job of encapsulating all of this information. So something that I found interesting, and this is kind of where we're getting into some of that new information, as I had the task of reading all of those implementation plans pretty quickly, I noticed some key trends, and I thought these were pretty interesting. So when I looked at the EMT Basic, I combined that with EMT Basic and EMT Paramedic. Between those two classifications, there are 41 total programs among all of the colleges with over 2,200 anticipated completers. So that is going to really help to bolster that EMT Basic or EMT Paramedic workforce. With the RN programs, there were 35 total programs and over 2,300 anticipated completers. LPNs, 20 total programs with over 560 anticipated completers. And then the CNA programs, there were 41 of them with nearly 5,000 anticipated completers at the end of this academic year. So when we look at that and we think about the reach of this program, those are really exciting numbers to see when we think about those healthcare shortages. This grant can, and the work that you're doing, can help to directly impact that shortage. The vast majority of the programs that were listed in the implementation plans were credit-bearing programs. So approximately 337-ish total credit-bearing programs, and about 54 that were non-credit-bearing. So like I said, those numbers, it's a really exciting thing to think about, that we know that shortage exists, and right here on, as we get started, we're seeing that we're going to make a dent in that. There were also a lot of really interesting programs that the various schools had listed out. There were a lot of programs that listed short-term non-credit programming that was geared toward unemployed or underemployed workers, and those were going to serve as an on-ramp to further educational pursuits. So as we see someone going into a CNA short-term non-credit program, they are unemployed or underemployed, we're going to get them to where they can support, have that livable wage, and then they see that they can move on. They've got things in order and they can move on to, LPN and RN type pursuits. I saw a few schools that were doing an expansion of their dual credit opportunities so that a greater number of high school students would be prepared as they're entering community college. And that will really help to build up future enrollment. That's the goal. That will help to build up future enrollment and future completions as we go through this PATH funding. I saw that a lot of the recruitment and promotional materials, when we looked at how do we reach those different populations, several were offering those materials, in multiple languages. So I saw some were going to offer them in Spanish. I think I did see one was going to offer in French. So making sure that we're reaching those communities that otherwise may not have this information as readily. I did see an implementation of addiction studies program, and that was something I needed to point out, because as you may know, I come from the behavioral health field. I come from substance use prevention and recovery. So that was something that I was really excited to see, that addressing that growing need that we have in that mental health space. Looking still at those notable programs, I saw that one of the schools, as we know, when a student goes into the nursing field, when they're going to getting ready to get into their clinicals, there are vaccinations they have to have, physicals they have to have proof of, all of that stuff. So I had at least one, I think there were a couple of schools that were going to work with a clinical partner to help administer those immunizations and those physicals, so that those students didn't have that barrier to beginning their program. Then also I saw several people were talking about clinical capacity being of major concern. And as you know, if there's a shortage in the healthcare field, in the healthcare workforce, then there's going to be a shortage of clinical opportunity. So there were some that were going to be partnering with long-term care facilities and getting, kind of creative in the hours even that clinicals would be offered. So I was seeing some weekend clinical opportunities, some evening clinical opportunities. Also really kind of trying to build some capacity for clinicals by doing some virtual reality and simulations to assist with reaching those clinical hours. There were a few that were going to expand their lab space to facilitate larger programs so they could reach that many more students in a clinical setting. There was the exploration of apprenticeship opportunities through local hospitals and clinics. That's something that over the course of the next year, I know we have an expert on the call. Rebecca Lake is on our webinar today, and she's going to be helping me work through some of those apprenticeship ideas, and just so that I can better support the colleges and, we can answer questions about that. And then something else I saw was a significant number of programs were going to use some of these PATH funds to hire success coaches. So when a student begins and they do have these barriers to completion, or just, they're nervous about having those barriers, I saw a lot of colleges stepping up with a success coach that was going to essentially help guide those students through these programs, help identify barriers, hopefully before they become too major to continue through. And they were going to really be that guide as the student walked through those programs. So again, just bolstering those completions by making sure that students know that they are supported through staff on campus, through the wraparound services that I saw funded. So those were some things that were notable as we went through the PATH grant implementation plans. Okay, so I realize that I speak quite quickly, and I actually would like to hear from some of you guys. This is just going to be an opportunity to share ideas with each other peer-to-peer. Perhaps you looked back at those slides and you saw that one of the programs you were implementing was mentioned in my, what I noticed as notable. This is going to be an opportunity for you to all share ideas with each other, and I'm going to kind of step back and let you all discuss. So some questions that you might be able to answer right now in kind of an open forum way of doing things. What are some unique recruitment strategies that you're using to build up your programs? I saw several schools that were concerned about the fact that students know immediately about nursing. They know that the RN program exists, but maybe they don't realize that, the phlebotomy program is there. So building up some of those lesser known programs. Also, clinical capacity, clinical mitigation was a very large concern to a lot of the campuses. So those of you who don't have that concern or who have had successes in gaining new clinical partnerships, what are some conversation starters that you've used? What's something you've had that has worked to get, those new opportunities opened up? The biggest barrier that you're seeing, and then looking at all of the successes that you've had or that we hope to have, what is something that has helped you overcome some barriers that we've previously mentioned, or what are some things that you're just really excited about that might help to overcome some of those barriers that students are inevitably going to face? So I want to step back, and I think Whitney might have to okay. Thank you, Stephanie. I'm going to unmute you. Oh, wait.
Thanks, Nancy.
There we go. Yeah.
Thank you. I guess one question that we've kind of had conversations around over here is, part of the funds that we're using is for recruitment. And so recruiting into, let's say, that nursing program, we might see that our admission numbers have increased, but since nursing is not a one academic year program, although the PATH funds have helped with that recruitment, how are we able to tie that into that target completion number that we've received? Does it not? Do we just do a narrative on that? Is that something that you guys have talked about with the understanding that nursing is not a one academic year program? Just some thoughts on that, if you could.
Yeah. That's a great question, and I'm sure Whitney may have to step in on this one, but I do know that when we were discussing it the other day, we do realize that a lot of these programs are not going to be one-year programs. Nursing is that great example. And you will have a chance on the quarterly report to put that in a narrative form so that it doesn't, so that it reflects that as such. Also keep in mind that, like I said, the completers, it's not going to look like you had no completers for the academic year in your other programs. Completers are in every academic year that the grant is active. So we're, obviously hopeful it's not going to be just one academic year. I think we're scheduled for 5. So Whitney could probably better expand on that. Oh, go ahead, Stephanie.
So it might flow into like an additional year if the grant continues.
Yes.
Okay, great. Thank you very much.
Yeah, so I just posted in the chat that this is obviously this 25 million is for this fiscal year. And while, the state budget is crafted annually and we can't guarantee funding beyond this fiscal year, this program was designed with sort of 5 years in mind. So we are hopeful to see funding happen, continue to happen over the next 5 years. And so, this balance, I think there's a balance here between meeting our completion targets by prioritizing and funding short-term and non-credit programs. However, noting that some of the priority healthcare occupations is nursing, right? And that's a 2-year program. And those completions may not happen this year for students who are starting this year, but obviously you can count students who started in years prior to this academic year. But they will be counted in years to follow. So it's really a balance of balancing the short-term and the longer-term programs and building those pathways that lead to one another. So.
Okay, great question. Thank you, Stephanie. And Stephanie, remind me where you are.
We are at Highland Community College in Freeport.
Okay. All right, thanks. So what else? What other questions do you guys have for each other? Some of you, like I said, that are really don't have that issue of clinical capacity. Is there someone that can kind of share with us some unique ideas for getting those clinicals done, getting those clinical hours achieved.
Hi, can you hear me?
Yes, yes.
This is Michelle with ICC, Illinois Central College.
Hey, Michelle.
And we're currently exploring apprenticeships with nursing, which is a different, and when I say apprenticeships, I don't mean once they're hired or over the summer. We're actually exploring an apprenticeship where right now we're piloting and potentially working with 2 different healthcare facilities to do this their 4th semester. So they either potentially would be hired or not hired, but during that time frame would work with the facility and be paid, but they would use their time for clinical hours. So it's a little bit different of a model, and it's being that I'm on the State Board of Nursing for Illinois and actively with National Council State Board of Nursing, it's something that's being done and looked at very heavily right now. And so we have not piloted it in Central Illinois. So this will be something very different and new, but it is met with a lot of challenges. I will share that right now. So we've had one exploration meeting, and wow, I probably had 2 pages of obstacles.
Oh, wow.
Of just ideas being, discussed and going back to the table and checking scope of practice and, like, do you have an instructor? Do you have a preceptor? How do you, check off those skills? And so this was, directly for the, nursing program. So it's definitely something that nobody is saying that we won't try to pilot or we won't try to come to some exploration. But we're looking at the student doing like 2 12s
Okay.
for like a 4-week or 8-week period. That would be their clinical hours for the semester. And so it's going to be interesting. Now, this wouldn't necessarily be every student, but we're hoping for, we're shooting for like 25%. And then that way it would then help having other students in clinical. It would also help with our faculty shortage as well. So we're trying to deal with 2 things at the same time.
Yeah. Okay. Thank you, Michelle. I appreciate that. Anyone else have any questions about capacity or clinical capacity or other suggestions that might be helpful to someone else with the apprenticeship? That's a great idea. I know there's a big, long road for that. What about barriers that you're seeing that you think you might see, or barriers that you've seen in the past for students to complete their programs?
Hi, can you hear me?
Yes, Rachel, I can.
Okay, hi, it's Rachel Hansen from John Wood Community College in Quincy. I just stepped out of a meeting with our nursing director and our grants coordinator and our business office. And we had a couple of questions that came up. Obviously the purpose of the grant is removing these barriers. One of the barriers that came up is a lot of our CNA students don't have a credit card and they have to pay $75 to take the CNA exam. And apparently a debit card can't be used. You can only pay with a credit card. And they don't have a credit card. And so we're trying to use the grant to overcome these barriers, but there's these external barriers that we can't necessarily overcome. So we're trying to come up with internal processes that don't necessarily match what our business office would want us to do, where we can use a college credit card to pay that and reimburse the college rather than the student. So I didn't know if there was any, and another along those lines, the $375 NCLEX RN test is too much for us to put on our college credit card. So we have to reimburse the student, but what if they can't come up with the $375? So I didn't know if, if voucher systems or anything were being talked about at the state level to try to, we're doing all we can, but I didn't know if any of the state barriers could be knocked down because it just, it seems like we take it so far and then we hit these state barriers that we can't do anything to overcome.
Mm-hmm. Mm-hmm.
We are not in conversations about that particular barrier, but I think that's really helpful that you brought that up and something that we can consider in our conversations with other various agencies. So thank you for bringing that up.
I can tell you what we've done at ICC,
That'd be
how
great.
we've overcome that.
Okay.
We purchased those Visa credit cards
Okay.
and we put the funds on those, exactly what they need for like Pearson VUE and for continental testing. So we'll
Okay.
put the 98, there's a $105 fee because it went up. And then we'll put the $200 Pearson VUE. So we're putting 305 on it. And then
Okay.
we give them that debit credit card, but we have them come to our computer lab. So we
Okay.
know they're spending it for that.
Okay. Okay.
And we have them sign in to CTS, and then they have that debit credit card, and then we have them sign into Pearson VUE and use that debit credit card.
Okay. That's great.
So we
Thank you.
just go fill all these multiple cards with that amount.
Oh, thank you. You guys are awesome. There's lots of people chiming in the chat too. Thank you.
Yep.
so much. I
We've been
appreciate
dealing
it.
with that for a long time.
Yeah, it's yeah, and this is new for us, so we're trying to figure all this out. So thank you very much.
Awesome. Awesome. And that actually answered that next question that, Michelle helps with that helped with looking at successes that you've had in overcoming some of these barriers. Anything else that any of you are just, kind of hoping to get answered that maybe some of your peers could answer? It sounds to me like if we could get some conversation started, we do have some expertise on the call today. So anything with recruitment or wraparound services, really just anything that anyone's struggling with.
So I'll share, this is Dave Sanders, President of Malcolm X. We had a couple of different things that we put into the grant. So one was we had a diagnostic testing partner who wanted to come in to our facility. And so we're going to be able to work with them to ensure that our the pre-work that our nursing students and some of our health science students have to do prior to entry into the program, that can be done on site. And so by partnering with them, they're able to do it right here on campus. And they also will do the exams for us as well. So everything is done right here. And that's something that our nursing team has been pushing for, because many of our students don't have the resources or sometimes, have not been to a doctor, and so don't have a place to go. And it creates a challenge for them. And ultimately, some of them get it done. Some of them, they're having some difficulties and get late. And of course, there's a cutoff date. So we want to address that. The other thing that we did was we went out to our hospital partners, and it's not so much embedded in this grant. We have another grant that we're working with and conjoining the two. Clinical education, especially here in the city, is a challenge. A lot of the seats are occupied, and a lot of the issues are that the hospitals and our other providers just don't have the capacity because they're having staffing issues. So we said to them through another grant, if we were able to fund you designating the clinical seats just for our programs, would you be able to do that? And they said, absolutely. And so it's going to expand our clinical opportunity by up to 300 students, which is a tremendous event for us. It's going to allow us to be able to expand our program. So those are some things that may be something that you might want to consider, and we certainly will be happy to share the information.
And you said that the with that clinical funding, that was through another grant?
Right. So,
Okay.
So we have, some workforce grants that allow us
Okay.
to work with, in fact, they demand that we work with a clinical partner to try to, again, address these staffing issues, which is the same intent of this program. So this one, right now we're using this internally to address things, but externally, how do we address this clinical capacity issue, right? And so by specifically funding the clinical education needs of our programs, the hospitals see it in two ways. One, it's allowing them to ensure that people are getting what they need them to get, and not at a cost that is coming to them. But on the reverse side, it also is a pipeline to these staffing shortages that they already have. And so it's kind of a win-win on both sides of the equation. And they're absolutely excited about this opportunity.
Right. Okay. Thank you for sharing that. That's great information to have. Anyone else?
I have a question about incumbent worker training. Are there any special rules for working with healthcare associations that are trying to upskill their entry-level workers? We don't know anything about the financial obstacles that those folks may be having. Is there a requirement to show that for those folks?
Okay, that's a good question for Whitney.
Yeah, and maybe I'm not understanding it, Paul, all the way, but this program is extremely flexible in terms of how funds can be spent. So just kind of hearing your question, it sounds like yes, as long as those individuals are in one of those eligible SIPs. So when you say you're working with an association, I'm just making sure that those students would be part of the eligible healthcare programs that we have listed.
Yeah, if they're entry-level workers, like maybe you have some orderlies or something that want to be up, that the company wants to upskill into CNAs or
Yes.
those groups.
Absolutely.
Work with them. Okay. Good.
Yep. So by being an incumbent worker, they're in that target population because that was one of the,
Right.
that's one of the three. So yep.
Mhm.
Good question. Okay. Anybody else? If not, we'll kind of.
Yeah, we're seeing some really great in the chat. We're seeing some great ways that the funds are being spent to overcome barriers for students. One thing that I would sort of lay out there, obviously we put this grant out there and it was a short amount of time for you guys to be thinking about how to spend these dollars. And with 1 year grant opportunities, acknowledging that we may have additional years, but no guarantee. I know capacity building is a difficult task for one-time funding that you're kind of quickly getting and need to spend. So, but that is an area that we really would love to see this funding support. And I know Dr. Sanders just talked about ways in which they're expanding and creating capacity for clinicals. And I think over this next year, we're going to dive into some additional ways because that is one of the pillars of this particular program, is expanding capacity and creating capacity for that growth in students, in addition to those barrier reduction for students. So just be thinking about, and I really would love to hear those innovative ways over the next year as you guys are working through and identifying capacity issues for us to help solve those. So just be thinking about that.
And I think that Whitney pointed out a really important fact. Like you guys know, this was a really quick turnaround for this grant. So this discussion is going to be really different a few months from now, 2 quarters from now. This is going to be a really different discussion as we all learn, what's working and what's not. So I'm glad that everybody's getting a chance to really discuss some ideas and share some ideas. And we know that you can, reach out and ask these questions. All right. So now we get to, I wanted to say we get to the fun part, and I don't know if anybody else would consider quarterly reporting to be the fun part. So I'm going to go over this, and then I'm going to share with you tentatively what that quarterly report's going to look like. We're going to have, as many quarterly reports do, there will be a narrative section that talks about these successes and barriers and just things that we cannot easily capture with quantitative data. So things that, if you have something, well, I think it was Michelle that asked about, was it Michelle or Stephanie? One of you asked about nurses not getting done in that first academic year. So in that narrative, you're going to be able to put some of that information in there, and we will see that each quarter. We're going to look at, obviously, your enrollment. Of that enrollment, who are the incumbent workers, or how many are incumbent workers. When we look at retention and persistence, that's, who is finishing, who's a completer that has culminated in a credential. And then obviously on every quarterly report, there will be some financial reporting. So let me stop sharing for a second and reshare. Okay, are you guys seeing the quarterly report on your screens? Nope. I love having two screens open. Oh, well.
Yeah, we're seeing it. I'm
We
seeing
see
it.
it.
You see it now? Okay. All right.
Mhm.
I thought I saw some heads shaking now. Okay, so let's start in the very beginning. So as you can see, there are all of these tabs at the bottom. With your fiscal reporting, there are instructions that will stay there. So you'll see that every quarter if you need a reminder. Your due dates are here. Obviously, 30 days after the end of the quarter is when these are going to be due. So you're going to have one tab is going to be all of the financial reporting. And that's going to be basically just that budget information. And again, that's broken out by quarter. So I'm only going to look at quarter one, obviously. So you're going to fill in the community college name. And in this spreadsheet, you'll have, like I said, that opportunity to do a narrative update where you can provide updates on your progress. And you can include things we've talked about, things like recruitment and outreach, anything you're doing to build capacity, these wraparound support services, anything that you think needs to be included in that narrative, go ahead and include it. Because again, that's stuff that's really kind of difficult to capture with numbers. So we can get to the heart of some information with this narrative. We would like to know about employers that are being engaged in your work through the PATH grant. So who are you reaching out to? What level of engagement do they have? What are they doing? Are they agreeing to be a clinical site? Are they providing some other form of support? And then also, when you see those students that have completed their program, are any of these employers hiring them? So if so, who? Who's hiring your completers and how many? So just really a broad narrative about what's going on with employers in your area. And then again, each time we will want to know about successes and barriers. So successes, we know what that's going to look like. Barriers, so what are some things that are coming up each quarter that have caused, concerns for you, concerns for your students? Also, I really would like for, maybe in quarter one, you have some barriers, but then in quarter two, you figured out how to overcome those. So I would love it if quarter two builds upon that and tells us, this is what we did to overcome the previous barriers. All right, so that is the narrative form. And then down here, and I just put some examples in here for you. So you may have more than 11 programs. So you're going to have to add rows if need be. And you're going to put in what the program is, what the zip code is it credit or non-credit, the total number of students enrolled by the end of quarter one, because that's the tab we're on. Who of those students are incumbent workers? So that's going to be a subset of column E. And then the total number of completions at the end of quarter one. Okay, so you can see that is going to then total at the bottom. So you'll need to put in those numbers and then the math will be done for you at the bottom. Now, I want to point out also that this does not carry over from quarter one to quarter two. So when we look at, I didn't put the information in there, but when we look at quarter two, this is going to be unique numbers. So you'll need to fill out how many students are enrolled by the end of quarter two. Incumbent workers and completions will be filled out in every quarter, okay? And then we have a tab right now that we have not really filled out, but we're going to go in and do that. Someone kind of helped us with adding this in today. So we're going to put some definitions in here because inevitably there will be staff changes or maybe someone different is helping with the report. So maybe someone will need a definition as to what do I mean by a credit program, non-credit, completions, that kind of thing. So just like we have the fiscal instructions over here, we're going to have some definitions here just because we want to make this as user-friendly as possible. All right, and I'm not seeing in the chat. So Whitney, I don't know if you're seeing in the chat. Does anyone have any questions about this quarterly report or anything? We're going to post this on our website, and I'm not sure, Whitney, are we sending out the link to this, or if it will just be something they'll go get from the website?
Yeah, we'll be sharing that later this week with this recording and some other resources.
Okay. All right, so I see one hand raised. Anna Marie.
Thank you. I just have a question about if you could go to your Q1 tab where you had, I think it was CNA, and there were 150 students enrolled. And then in Q2, you were saying that those are to be unduplicated counts. So if, for using CNA as an example, if 150 students are enrolled in Q1, but they are still enrolled in Q2, what value are we putting in that Q2? Is it 0 because it's you want unduplicated numbers? I'm a little unclear on what you're asking for.
Right. So what I wanted to make sure that I'm saying clearly, this number 150, that's not going to carry, there's no formula here to carry that over. So you'll need to enter the number of students that are enrolled at the end of Q2 as well. And they can, Whitney, they can be duplicated, correct?
They will likely be the same students in Q1 as in Q2.
So you are accumulating them yourself instead of saying, we're not counting students who are entering in the quarter, just as it stands, right? If 150 students enroll in Q1 and those 150 students are still enrolled in Q2, that is the number that you will put in Q2.
Okay, thank you.
Likely that number will change because if they've completed, right? Or if you have additional enrollees, it's just where are you at the end of that quarter for all of these particular performance indicators.
Understood. Thank you.
Good question. Thank you for asking. Any other questions about this?
Yeah, we went back and forth on adding a cumulative total. It gets a little disorganized, and we find that this is just best for you to, at the end of each quarter, take stock in enrolled, completed, and other subsets of numbers.
Okay. All right.
We have a raised hand, Brett.
Yep. Oops, hold on. There you go.
So we're listing all of the programs we had and their numbers, regardless if it's a program that they will actually complete during this. So like we're listing RN, and it's everyone who's in the program, whether it's their first semester or their third semester.
Yes.
Yes.
Okay.
Yep. That way you're capturing all of the numbers of who is in the program at that time that you're filling this report out.
Great. Thank you.
Anybody else?
Megan asks about the definition of an incumbent worker. We will add that to we do have an FAQ for those of you who may not know that we have an FAQ. We'll add that to our FAQ, but generally an incumbent worker is someone who is in the healthcare workforce that you are planning to then upskill.
So someone mentioned an orderly that wants to become a CNA. So that would be an incumbent worker. Okay. What other questions?
Do you have suggestions? I'd be curious to see how the group is tracking incumbent workers currently, if they are.
That's a good question. How do you track your incumbent workers?
Yeah, so I would say the best way to do that would be through some sort of, as it relates to intake, but then also if you have an agreement with a hospital or a clinical location where you are doing like non-credit training for those individuals, then you would know that those are incumbent workers. So I don't know that there is a one way that would work for counting all incumbent workers, but I think as a part of intake, that would probably be the best way as well.
This is Michelle with ICC. We have a demographic form that we supply to all of our students coming in to our programs that answer the questions, male, female, race. We also do our targeted populations, but the other side is, are you employed anywhere? And, you know, obviously in healthcare, how many hours a week you work, et cetera. So that's where we extract most of our data.
Great, thank you. Anybody else? Okay. Let's see if I can get my share to go back to telling you. Okay, are you seeing what I'm seeing? All right. So the due dates for those quarterly reports, again, are 30 days after the quarter ends. So October 30th, January, April, and July 30th. Something else that we want to talk about, other deliverables. So this is in the program design. So we have the completion target. That's, you know, that's the big thing that we're looking at on that quarterly report. We also want to be sure that everyone, and this is going to go in those narrative sections, you're carrying out activities as you outlined them in the implementation plan. So that implementation plan is going to really serve as your roadmap as you work your way through this funding. There are going to be grant meetings that you're going to be required to participate in. Professional development opportunities will arise, and then technical assistance that, you know, as ICCB designs or with our partners. As I mentioned, obviously quarterly reports, and then there will be annual submissions through the regular ICCB MIS submissions. There may be some supplemental attachments, and we are working on those details as well. As soon as everything is out and ready, we will obviously let everybody know. But those are going to be those other deliverables at other duties as assigned, as we all are pretty familiar with, but those are going to be the other things. So basically you're following that implementation plan, getting technical assistance as needed, that kind of thing. Which brings us to upcoming professional development and support. We do have the Forum for Excellence next week, September 22nd and 23rd in Bloomington. And then there will be training for the Workforce Equity Initiative model. We do not have that set yet, so that's to be determined. And as soon as that is set, then we will again let everyone know when that is going to be and where. Okay. All right, so we have about 10 minutes left. And this is when I would love to just open it up to any questions that you may have. I feel like we have really had some good discussion today, and I like to see the peer sharing. It's nice for me that a lot of you are answering these questions, and I'm learning from you as well. So what final questions do any of you have that, you know, are just kind of pressing that you're thinking about while you're sitting there?
With regards to that professional development, is that available via Zoom, Teams, something of that nature?
Good question.
Are you talking about the forum or the WEI model, Kim?
I'm sorry, what did you say?
If you're talking about the forum, there is virtual as well as in-person options. If you're talking about the WEI model, professional development, likely that will be some sort of webinar. In addition to those two professional development opportunities, we would like to propose to you all, you know, if you're interested in some sort of learning community, you know, I hear you all are asking for each other's contact information. So maybe Stacy, we can post the contact list on our Path Grant webpage for you all. That way, if you want to reach out to an institution, you have that point of contact. You guys can always utilize the Path listserv to ask questions of one another or to us as well. So learning community, yeah, what are your thoughts? We're happy to facilitate that for you all. We could have regular meetings or meeting times, you know, open. We can schedule different topics. It's really up to what you guys want to do. We're building this year as well.
And that's something I can send out in an email just to get, to get that vibe of, what kind of learning communities are you guys interested in? How frequent? That's a question that I can post and put in an email to everyone and kind of gather that data so we can get that to, serve everyone in the best way.
And I'm going to clarify the Forum for Excellence just because there may be a couple folks on here who aren't familiar with it. The Forum for Excellence is our annual adult education and career and technical education professional development conference. So I didn't want you all to show up to the forum and be like, we thought there was going to be this list of sessions specific to PATH. Stacy and I will be presenting on PATH, but it'll be similar to what's been shared today. However, there are other sessions around dual credit, adult education bridge and IET programs, as well as, essential employability skills. So things that are definitely applicable to PATH. And you can utilize your PATH grant to pay to attend the Forum for Excellence virtually or in person. We'll include the information for the forum, and that's next week. We'll include that in the information that goes out over the next couple of days. Some other questions in the chat: process for like a budget modification. Yes, there is a process that's similar to all of our other grants. And so we will make sure that that's shared out. It should also be detailed in your grant agreement, which we have been notified that all grant agreements have been sent out to date. If you're finding that to be untrue, please contact us and we'll just make sure that the point of contact was correct.
Also, I have received a few phone calls and some emails about point of contact changing. Don't ever hesitate to reach out to let me know that, just to make sure that I'm getting everything to the right person.
Additionally, I did want to pose to the group, we were approached by another state agency who has some potential funds for healthcare, and we obviously talked through this PATH grant program. So one of the questions they asked us to share with you all is to be thinking about if there was a need for capital outlay or construction as a part of your healthcare programs, what would that look like and what would be like a general dollar amount? And if you could share that back with Stacy or we're going to collect that information. And as we continue our partnership with this agency, there potentially could be some additional dollars to support your programs, particularly for capital outlay and construction. Some of you have that in your grant now, but since that wasn't the main purpose of the grant and the funds weren't, huge amounts, in thinking about how much it costs for renovations and outlay, we do understand that could be a need. And so, if that is something that you think your institution would be interested in, if you could just share back what that is and potential dollar amounts that would be needed, that would be helpful.
And that would be focused on these same zip codes?
It would be I don't know the specifics at this point, but healthcare in general, I know that obviously we've excluded a few healthcare programs from this particular grant program, but so just more general. Paul, you can share that.
Okay, thank you.
Okay, so like Whitney said, all of this information, this recording will be uploaded, I would imagine by tomorrow. We will be sending out links to the quarterly report, this recording. I think that's it, if I'm thinking correctly. But yeah, that should all be coming within the next day. So if you guys don't have any more questions, I can't see the chat. So if you have questions, great. If you don't have any more questions, I really appreciate your participation today. It's been a great, I do see Jory has a question.
Just really quick on funding. We aren't able to spend until we had gotten the grant agreement executed. So we're now limited with the amount of time we have to spend the money. So construction might not happen to where we spend all that funding. What happens in that instance? I mean, we might not be able to, and we only have 9 months now to talk to the amount we've been given at JJC. What happens in that instance? Can we just write that up in the narrative? I mean, I know the funds are guaranteed funds that we're all allotted. I understand that part, but our time frame's getting shorter and shorter. So is that an issue? Can we have a little bit of guidance in terms of what happens if we don't? Like, I have a position written in the grant that I want to be able to start to utilize, but I can't hire it. I couldn't hire it until I knew the grant agreement came through. So that, I guess that's where I'm going with that, is if we can't show proof that we've fully utilized all of the funds for this year, is that okay?
Right. You're asking if you're able to send back dollars? I mean,
No, definitely not. I'm asking if there's going to be an issue if we show we haven't actually fully used all those funds that are earmarked because of
yeah, I
only
mean, if
having
you
9
don't
months.
utilize all the funds, you'll send those other dollars back, but we could potentially talk about a grant extension, Jory, if that's something that makes sense. Do they roll over? I mean, again, we're expecting potential funds in the years to come, hopefully, right? Fingers crossed, but we can talk about grant extensions. They're state funds, they don't necessarily roll over. We would have to extend your current grant. But we can talk about that maybe closer to that fourth quarter when you guys have an understanding of what that looks like. But
Okay.
But grant agreements should be out. So if you're missing a grant agreement, contact us. All right, we're right at noon. Thank you all. It's good to see you, and hopefully this was helpful and more information to come. So thank you, Stacy, for walking us through that.
Thank you, everybody, and have a great rest of your day.